Hi everyone, I'm Dr. Meagan Shepherd. I'm an allergist immunologist and I'm an owner of a private practice, Shepherd Allergy. I'm here today to talk to you about something that I call cliniccalm. This all came about when I left my tenured academic position about 3 years ago. I decided that that was not something that I wanted to do anymore with my life. I found the stimulation of being around so many people in such a large place every day to be very overwhelming for me. And that didn't even count the time that I was actually seeing patients. So when I decided to leave my academic practice, I decided whenever I set up my new clinic, I wanted to design my day to conserve my energy and for me to be able to really best serve my patients. I didn't realize it at the time, but the thought process that I used later became my framework for the Allergy Aesthetic Method, which is a lifestyle system that I use for people and patients to help them achieve better routines that really serve them and let them live beautifully and freely. So step one is tune into your sensitivities. This is where you take a look at where your real pain points are in the day. And my secret is that my pain point at my old job actually started right whenever I pulled into the parking lot in the mornings. Even saying hello to multiple people from my car coming into the building was mentally draining for me. So when I decided to open this practice, I decided to make sure that those little things that bothered me throughout the day, that they were lessened as much as they could be. So that is really the first step. Tune into your sensitivities. Number two is soften the space. I did this by making sure that we have a very lovely environment for the patients and additionally for the staff. In our room, we made sure that our office, we made sure that we have very soft lighting and we try to keep the noise level to a minimum so that when we come out of the patient clinical area, we actually have a space of calm. And I think that we're able to then carry that peacefulness into the patient room whenever we go. So number three is choose calm foundations. This is when you want to set up clear, predictable systems. So for instance, in our clinic, one of the things that I noticed was that we had a lot of disconnect between the front desk and nursing staff with scheduling when we needed to have patients come back for testing. So what we ended up doing to make that run a lot more smoothly for the patient and honestly for us as well was to have our nurses learn the basics of the scheduling template so that they could actually schedule patients for the follow-up testing to come in when they wanted and when we needed it to be done, and rely on the front desk more for general follow-ups and things like that. Finally, you want to build routines that breathe. So that means that once you have an established system, you want to keep working on it, keep doing it, and see what works for you, reassess. And if you notice things then that are not working, be fluid and think it's okay to change them if you need to. The payoff is real. Patients really feel very cared for, and I think that calm environment that you have within really translates to them. And while intention is important, you need many tools to support that. So number one is an excellent staff. Number two is that you sometimes need tools like a good EMR. So ModuleMD is an excellent example of something that can help you streamline charting and calm workflows throughout the day to make life a little bit easier for you and your parents. And it makes it so that calm isn't just a moment, it's something that lasts. Thank you for listening.